The broadcast is now starting. All attendees are in listen-only mode.
Hi everybody, and welcome to the National Hispanic and Latino ATTC's webinar, Intimate Partner, Violence in Hispanic and Latino Populations. Today's webinar will be presented by Dr. Luz Lopez, and I will tell you a little bit more about her soon. During today's webinar, all participants will be muted. The audio will be streamed through the computer. Please make sure your computer speakers are turned on and up to hear today's presentation. Now we're going to review a few housekeeping items with everyone. So if you notice that your viewer does not fit your screen, you can expand it by clicking the expand button located in the top right corner indicated by the red arrow. And here it is. Now you'll see that your viewer is expanded to fit the entire screen. Also, you can collapse the GoToWebinar toolbar on the right of your screen by clicking on the small red arrow on the left of the toolbar. Here we go. And then click the arrow again to expand the toolbar again, and it will expand. For today's webinar, all participants will be muted as we move through the presentation. If you have any questions for our presenter, we ask that you use the chat box on the toolbar. You can simply just type your question and hit send. And what we're going to do is that at the end of the presentation, we're going to take a few minutes so that we can take your questions. A recording of today's webinar along with the PowerPoint presentation slides will be available at our website, and you have the address on the screen. This will be about a week from today. You can also find recordings from previous presentations and webinars on the same address. One NADAC, one NBCC, and one ICRC continuing education credit is available to those who attend today's live event. If you're interested in obtaining CEUs from these organizations, please email us at hispanic@attcnetwork.org. Today's webinar is sponsored by the National Hispanic and Latino ATTC. As of October 1st of 2012, the network has been restructured and now consists of 10 regional ATTCs, 4 national focus areas ATTCs, along with the network coordinating office. As you can see by this map, the ATTC network regions were realigned to better fit the current HHS regions. And the 4 national focus area ATTCs are listed on the left of the screen. Today's webinar is the 7th in a series that the National Hispanic and Latino ATTC is offering. The ATTC network is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, and serves a critical role in improving the health of the United States. The network achieves this by translating, disseminating, and promoting the adoption and implementation of evidence-based clinical practices, and strives to improve the health and wellness of individuals whose lives have been impacted by substance use disorders. As mentioned, the ATTC network is funded by SAMHSA. SAMHSA strives to reduce the impact of substance abuse and mental illness on America's communities through its programs and services, and demonstrates that behavioral health is essential to health, that prevention works, that treatment is effective, and that people can recover from mental and substance use disorders. Okay, so now I'm going to introduce our presenter, Luz Lopez. Luz Marilis Lopez was born and raised in Puerto Rico. She completed her PhD degree in social work and a master in public health from Tulane University in New Orleans. She is a faculty member at Boston University School of Social Work since 2005 and currently serves as Associate Director of the dual degree MSW and PH program. She has 18 years experience in HIV prevention, outreach, and implementation of trauma-focused evidence-based interventions for Latinos and other ethnically diverse groups. She teaches clinical practice, group interventions, and advanced courses in substance abuse. Dr. Lopez also conducts an annual cultural immersion travel course and has research experience in Puerto Rico from Boston University with her graduate students. Now we're gonna do our poll questions. The first one is, okay, are you planning to serve Hispanic and Latino populations with substance use disorders in the next 6 months? So we have 60% yes, 14% no, and a few don't know. Okay, we're going to close that question. We're going to go to the next question. Do you currently serve Hispanic and Latino populations with substance use disorders? Here we go. And among our participants, we find that 73% say yes, 27% no. Next question. What is your current professional role? Are you a counselor or therapist, social worker, case manager, student faculty, administrator, policymaker? So we have 37% counselor, 25% social work, 21% administrator, and 24% other. Some student faculty, a few. What type of setting do you currently work in? Substance use disorder, psychiatric facility, university, managed care, primary care unit. So we have about 50% substance use, 6 to 7% psychiatric facility, 10% university, 24% managed care, and 14% primary care. Which field of work do you represent? Education, policy, mental health, substance use disorders, or research? So the majority is mental health, about 40%, 30% education, and then 19% substance use disorder, 7% policy, and 4% research. We're going to close that one. Thank you, everybody. That was our poll. And now we're going to turn the screen to our presenter, Luz Lopez. And you remember, you can ask your questions through the chat.
So buenas tardes a todos. I'm very happy to share this webinar with you, and I'm glad to see that a lot of you are working in substance abuse field. The topic of today is intimate partner violence in Hispanic and Latino populations. Intimate partner violence and sexual violence are public health problems that disproportionately affect racial and ethnic minorities, especially Latinos. Intimate partner violence has been defined as physical, emotional, psychological, verbal, and sexual abuse between two individuals engaged in a current or previous romantic relationship. We know that there is a large correlation between trauma and the use of substances. As many as 80% of women who have been in substance abuse programs have a history of domestic violence. Many men in addiction treatment also has extensive trauma histories. Individuals who have experienced post-traumatic stress disorders are 4 times more likely to have a substance use disorder diagnosis than those without PTSD. The effects and impact of intimate partner violence may be greater in persons from Latino communities and other ethnic groups, given the significant economic and health disparities of these groups. Latinos face the challenges of acculturation and immigration status. Latinos in the United States are in diverse communities, and we need to address these challenges by community-based research programs and sustained programmatic efforts. Familismo and shared trauma between family members often discourage Latinos from seeking help and support. We know that in many cases, because the individual doesn't want to put the family to shame, they don't seek out help. So we can help them with that process. Other components that affect people with substance abuse disorders are the interaction with drug dealers when they are actively using sex work, which when they are doing sex work, they also suffer violence, fear of overdose and contracting AIDS or other STDs, and periodic arrest or confronting the dangers of living on the street. For some individuals, alcohol and other drugs have been the primary coping methods to suppress traumatic memories. So they use substances to numb their pain. And many times they don't make the connection between the past abuse, domestic violence or interpersonal violence, and the current use of substance. The use of heroin, cocaine, alcohol provides temporary relief from the accompanying symptoms of anxiety, panic, and depression. So what happens when the individual has both the trauma history, where there is a failure to develop connections with other people? They lose a safe base, they lose direction, they lose communication and relationship with family members and important people in their life, and they lose the ability to detect danger cues. All of that impact is further complicated by the use of substances. And we know that in many of our substance abuse programs, there is a lack of integrated services. Many programs deal with addiction only or with trauma only, but not integrated services. And that impacts also the rate of HIV/AIDS. We're hoping that with this version of these services. Lisa Najavitz talks about the tendency when somebody suffers abuse of having fragmented parts of themselves. Increased reactivity to trauma-related and substance abuse situations are triggers for more abuse. Not in relationships that are too close or too distant. People have problems with boundaries and intense feelings of personal failure from which is very difficult to recover. This personal failure is not just the individual failure, but the collective failure of putting their family to shame. Substance abuse and psychological disorders of mental health carry a great deal of stigma, feelings of shame and hopelessness. We know that in our culture, in the Latino culture, there are a lot of taboos about emotional distress, about mental health. These are taboo topics. And when somebody's using, it's also very taboo. People don't want to talk about it. So we have to address this in a culturally appropriate treatment. One of the important parts is the assessment process. In this, we can ask the individuals the length of time in the United States, because it makes a huge difference. As you know, the time that they migrated or immigrated to the United States. The level of language acquisition. Is it English their first language or Spanish? Having family members in their countries and how often they communicate with them. And we know now with technology, Skype, computer, and phone cards, people are able to communicate more often. However, people that are in recovery or in substance abuse programs may have had severe the relationship with their family members. So we have to help them reconnect with them and then find ways that they can continue communicating across distances, depending on the state, and also depending on the economic status, to see if they have tools to communicate with them, have computers or access to Skype. And then it's also important to assess the spiritual beliefs, how strong connections they have to their own sense of hope and sense of healing. In having cultural awareness, in working with addicted individuals, we have to assess the coping and recovery methods that are consistent with their cultural identity. Find activities that reinforce aspects of their cultural identity that are important to them. It's not the same somebody from Venezuela that somebody from Puerto Rico or somebody from Central America. Seek out recovering role models who are from the cultural group and identify ways that others in their cultural group have coped and moved toward recovery, how their peers in the treatment have found ways to maintain their recovery process. Community health education models that consider trained peer leaders or leaders to promote health and violence prevention is crucial to have a culturally competent way to address these individuals. Enhance outreach techniques into Latino communities by avoiding a one-size-fits-all approach, as language, education, and level of acculturation may vary between and within groups. Latinos come from diverse communities and cultural origins and diverse levels of acculturation. Learn about the organizations and groups they have formed, their concern, and the access to service providers. Hire and train bilingual and cultural direct service staff, advocates, and health professionals to help Latino families who are also dealing with the stigmas, prejudice, and cultural taboos of domestic violence. We have to appreciate the perception of self and others affects views of addictions, the point at which help is needed, and try to help that is preferred. Assess intergenerational tension. This is a problem when we are residing here in the mainland United States. Cultural differences causing difficulty in treatment engagement. The reality is that many programs do not have bilingual staff and do not have people that represent the individual that is receiving the service. Last, lack of ethnically similar peer group in residential treatment or in the neighborhood or in the community affects the effectiveness of the program. It's also important to explore the refugee and immigrant experiences of some of the Latinos that have moved here, that have experienced, survived violence due to war, not just intimate partner violence, or that they were escaping or moving here because of domestic violence in their country. That those traumatic experiences are exacerbated because of the drug use and need to be addressed as part of the treatment. Trauma and addiction requires creating an environment of trust and safety, non-judgmental views of past actions, coping mechanisms, the establishment of communication with others, and understanding that addiction recovery takes time and relapse is part of the process. So we use a harm reduction approach to treatment, especially when somebody have had a history of trauma and abuse. The individual needs to combat social isolation and feelings of shame there are three group interventions that have been found to be very helpful in working with Latinos. One is Seeking Safety, the treatment model for substance abuse that was developed by Lisa Najavitz. She is now currently working on a new model that is going to come out next year. But this curriculum has been very helpful and tested among Latinos. The TREMP, Trauma Recovery and Empowerment Model by Maxine Harris in Community Connections in Washington, D.C., has been also very helpful, and it is translated and culturally adapted for Latinos. And the other one is MTRAM, Men's Trauma Recovery and Empowerment. This curriculum was developed by men, and it has been also translated and culturally adapted for Latino men. These are men who have also suffered sexual violence and abuse. So any of these interventions could be very helpful for your treatment program, and could be adapted also in the length of time. Most of these are group interventions, but some of the sections can also be used in individual sessions. So I hope this overview is helpful, and now we are going to open it for questions and feedback.
Thank you, Dr. Lopez. We have a few questions. First, you mentioned stigma, prejudice, and cultural taboos of domestic violence. Can you be more specific about what that means in the Hispanic community?
In the Hispanic community, there is a lot of pressure to maintain the family as the center. That's what we define as familismo. And when there is trauma or abuse, there is a pressure to keep silent and not to talk about it, because you don't want to put your family to shame. Also, when there is domestic violence or intimate partner violence, many times, not just in the Latino community, I think in all, it's hard for neighbors or people to reach out to them, and for the woman who experience, woman or men, but especially women, who experience the physical abuse, to go and ask for help, because they want to maintain those connections with their families, and they don't want to put them to shame.
So how would a therapist go about working with that cultural factor? What recommendations?
I think a therapist could develop a therapist could develop trust with the individual, and gradually work with her or him so they feel that they can reach out for help, and that the family probably will help them in the process of getting help, and that they need to be safe and work with the emotional distress that is causing. But it may take some time to develop that trust.
Okay. Okay, we have a few other questions. Do you have a recommendation for an evidence-based assessment tool for intimate partner violence?
I don't have one on the top of my head, but I could find it and we can post it.
Okay. Okay, perfect. We can do that when we post the answers to the questions. Okay, another one, you spoke about acculturation and how that can be a factor in assessing the length of time the person has been in the United States. Can you explain a little more what acculturation means and how it can be, how it can play a part in all of this? Can you hear me? We're having a difficulty with the sound, with the audio.
I could not hear.
Okay, can you hear me now? Now? Can you hear me now, Dr. Lopez? Okay. Did you hear the question or no?
Hello?
Okay, ¿me oye? Can you hear me?
Did we lose the connection?
We're
No,
still on.
but
We're still on.
we're still on, but I couldn't hear you, and I don't know if you heard the question.
I couldn't hear the question.
Okay, here we go. You spoke about acculturation, and you mentioned that as part of the assessment, it is important to ask the length of time that the person has been in the United States. So could you say a little bit more about what acculturation is and how it can play a factor in intimate partner violence?
Acculturation is the process of adapting to the culture or of the, in this case, United States, not assimilating or becoming the identity of the main culture, but integrating aspects of it while maintaining your own identity and cultural roots.
Mm-hmm.
And sometimes it's hard to talk about taboo topics such as domestic violence and intimate partner violence. So it affects, as I mentioned, the way to reach to service providers or people that can help them get out of that situation. But when the person has been here in the mainland United States longer, they are able to access other services and resources and maybe other therapies or people in the community that could help them access the services that they need and a way to better cope with their abuse. Also, they learn the language and the emotional impact of their abuse, and they're able to talk more freely about it. Also, it's important to assess the length of time because of the language acquisition level. If the person came recently from Latin America, Central America, or the Caribbean, Puerto Rico, their Spanish language may be their
We're losing the audio again.
first language or main language. Oh, but did you hear my answer?
No, yes, except the last part about the main language. If they come from, you were saying that if they come from, for example, Puerto Rico or the Caribbean, the language, the first language, and that's when you got cut off.
Oh, I was saying that if they come from the Caribbean, Puerto Rico, or Central America, Latin America, and their first language is Spanish, it may be more difficult to access services that can help them to heal from violence, to reach out to counselors or treatment providers, or even in the hospital. If they have an incident and they go to the hospital, it will be more difficult to talk about it if they don't have bilingual staff or bilingual people available. So that's what is important to assess the level of language acquisition related to how long they have been in this culture, in the mainstream, in the mainland United States.
Okay. Thank you. We also have a question here that says, to Seeking Safety and TREM, are Seeking Safety and TREM published in Spanish as well as English? I know that Seeking Safety, they are published in Spanish. I'm not sure about TREM.
TREM is also published in Spanish. It was translated a few years ago and culturally adapted by Dr. Tensi Amaro, and it's available in their website. Dr. Tensi Amaro and her staff.
Okay, so that would be a tool that people can use when they're working with Hispanics, right?
Yes. And those tools, those curriculums are very helpful because they have a guide, accompanying guide for the counselor that ask the questions that you can ask and possible answers that people receiving the service may say. So it's very helpful to follow those questions and those guidance. And it has exercises and activities that you can do while working with the group or the individual. But it's important to be trained in these tools. Both the train and Lisa Najavis have training staff that could come to your agency or could provide the training for how to deliver these programs.
Okay. I think thank you. We have one final question so far, and that would be, what are the views of women, the cultural views of women that may have an impact on how a woman might experience and give meaning to an intimate partner violence experience?
Repeat the question again.
Okay. What are some of the cultural views of women that can play a part with Hispanic populations that can play a part in how a woman experiences and gives meaning to an intimate partner violence experience?
I think it depends on the level of education and the level of acculturation of the woman. So that is important in this answer, because I don't think is one answer applies to everybody. So in our Latino culture, women are strong and empowered and have a voice. But sometimes in certain Latino communities, some of them may feel that they lost their voice because of the abuse they are experiencing or the fear to reach out to others and the impact that they may have in their children or in their family. The abuser many times uses their power to scare them or scare their children. And in that way, it may become harder to go reach out for help. But it depends, again, on the access to services. And if they have other Latino trained individuals that they could speak about this, maybe it will be easier to reach out for help. And the woman to feel empowered to get out of the situation.
Okay. Thank you. So those are all the questions we have for now. So any other final remarks or questions? We still have time, so you can use the chat to do that. Okay. We don't have any from the participants. Dr. Lopez, is there something else you want to add?
No, I want to thank everybody that is listening. And if you have any other questions, my email is posted, and you can email me or contact me at Boston University. And I'm very glad that we are having this discussion today, this topic, and I hope I answered your questions.
Thank you.
Thank you so much.
Thank you. So now we're going to change presenters again. And I would also like to take a moment to thank our presenter, Dr. Luz Lopez. We really appreciate your time and effort in doing this webinar. And for our audience, just a reminder that a recording of today's webinar and the PowerPoint presentation slides will be posted and available approximately a week from today at our website, and you have the address on your screen. So this concludes today's webinar. Please look at our website to learn about future webinars, and as you leave today's webinar, you'll be directed to complete a brief survey about your experience. Your feedback is very important to us, and we appreciate you taking the time to tell us what you thought of today's webinar. So thank you, everybody, and have a great day.